the chat and type into the chat and scroll through and see who all's with you. Oh, thanks for that. Yeah, we can just turn to video now. I don't have slides to show you. So anyone who wants to turn on their video, please feel free, and we can feel like we're here in a room together. So I'm going to kick us off with the lightning rounds and just give a little bit of an update on the Act Early COVID-19 grant, the initiative, and what's been happening with that. So hopefully everyone remembers that we had that separate Act Early COVID-19 funding. Chris Barnico isn't able to be here today to give the update directly as the Act Early ambassador, so I will do my best to do that. And we're sorry that she couldn't be here with us for this particular meeting. But if you remember, we probably last talked about this when we were doing the needs assessment. So the Act Early COVID-19 initiative pulled together several people from this team, people from Birth to Three, the Maternal and Child Health Programs, Children with Special Healthcare Needs Program at DHS, the Home Visiting Program, Diane representing the AAP and pediatricians, probably missing people, but just a number of folks. And we did a needs assessment related to how are things going in terms of early identification of kiddos, and how is COVID-19 impacting that? And when we were thinking about early identification, we were really looking at those steps of developmental monitoring, developmental and autism screening, and then referral and getting into early intervention. As part of the needs assessment, the formal needs assessment process given to us by the CDC was really focused on leadership, getting answers from leadership in these organizations. And so part of our needs assessment actually identified the need to hear from families and to understand what they were experiencing. We're particularly interested in the families that are socially and economically marginalized in some way, and most falling through the cracks. So one of the new developments is we have a couple of family leaders in Milwaukee, a Latina mom and a Black mom, who have been LEND trainees with us, who are leading a listening session this month, and perhaps more than one, depending on how many families are interested in sharing. And we'll be able to really get some input from families about the nature of the experiences they've been having, and we'll be feeding that back to our partners. Another thing that's happened in this initiative is that we've updated the Act Early Wisconsin website, the website for families and providers in the community. We've translated that into Spanish as well. Finally, we've reinvigorated our Facebook presence and really trying to make sure we're creating opportunities for families to engage with the Learn the Signs Act Early resources and learn about that. Chris has also supported outreach in Milwaukee in the transit system, putting up advertisements that let people know about these materials and the milestone tracking app, and an ad on or sponsorship on the Wisconsin Public Radio, so NPR, WPR. So it's been kind of fun to hear. You might have heard some of these things out there or seen these things out there. So please, in your organization or agency, if you have Facebook for your program, connect to the Act Early Wisconsin resources, and we'll just keep trying to use that as one tool for getting the word out. We have ordered a lot of children's books, materials. Some of them are focused on resiliency, supporting resiliency, and some are from the CDC, and we've been distributing those through Birth to Three programs, Reach Out and Read programs at the pediatricians' offices, and the home visiting program. So Chris could tell you much more about the wraparound or the supports that have been put in place so that there's a bit of engagement with the families as the books are shared through these programs. But kudos to Chris, to all her work to support the providers in that effort. And I think that's, there's more going on, but those are some of the highlights I wanted to share with you, so you'd have some sense of what's evolving in that effort. And then I wanted to kick it over to Lindsay, who had some updates on us for us about things that are happening in the state and with the budget that might be relevant.
Sure. So this is not my area of expertise. There might be people who know more, but I will share what I know. So the Wisconsin Autism Providers Association, or WAPA, has really been working hard to advocate for a rate increase for behavioral treatment for autism in the biennial budget. And so they had initially requested a 25% increase across all behavioral treatment codes to help with access and equity for services and to help with recruitment and retention of behavioral treatment providers. And, you know, there's a lot of back and forth, a lot of support, a lot of advocacy, but ultimately what is in the governor's budget that's been approved is a 15% increase for the most commonly used direct treatment code. So that intervention provided by a technician. And so that will, again, help really with recruitment and retention of those treatment providers, but also with equity and access to services. So I think if people have questions or want more information, Becky Thompson is the president of WAPA. But additionally, in terms of things we can do is reach out to our representatives and really send a note of thanks for supporting that legislation to hopefully increase access to services through Medicaid. So I can try to answer questions, but if I don't know the answer, then I can definitely gather questions and pass them along.
Anyone have questions about the two updates we've given thus far? We look forward, you know, we will continue to have these Act Early State team meetings and have these lightning rounds. And as you have ideas of things that you think others in the team should know about, might want to know about, that could fit this kind of an update, please let Nicole know, and we can include that in future meetings. But we also have a couple of minutes right now if there was something that anybody wanted to just let others know about on the team. Please unmute yourself and let us know.
This is Molly. Can I go ahead and share?
Please.
Okay, great. So the Board for People with Developmental Disabilities, like the Weizmann Center, got some extra funds for COVID. And so one of the things we're doing is a vaccine helpline. So I'll just put that in the chat. So if you know of any people, families, whoever that would like help scheduling a vaccine appointment, that's a resource people could be accessing.
Thanks, Molly. Super. Great. So glad we had a moment to open the floor there.